my good friend and colleague from Georgia, Dr. Paul Broun.
I thank you, Dr. Gingrey, for yielding. I think the American people need to look at what President Obama said as a candidate and go back to what Dr. Fleming was talking about just a few minutes ago about the options. Republicans are offering options because certainly we need to do something about health care financing. People are hurting. Health care expenses have gotten too high. Medicine's too high in the drugstore. Doctor bills are too high. Doctors actually earning less money today. When I was practicing full-time prior to coming to Congress, I was making in real dollars less money than I did 20 years ago and seeing as many or more patients. And we see the whole healthcare system being strained tremendously. But candidate Obama talked about giving the American public options, a public versus private option. He said, if you like your current insurance, fine, stay there. But as Dr. Fleming was talking about just a few minutes ago, what President Obama is actually offering us is a reduced price health care financing system that's going to take away people's choices. It's going to take away their ability to choose their doctor. It's going to take away their ability to choose the hospital, what medicines that they have. It's going to delay them being able to get needed procedures, surgeries, been delayed in getting x-rays that are needed, ordered by their doctor. It's going to take the choices away from the patient, and it's going to put those choices in the hands of a Washington bureaucrat. And I don't think the American people want that. I'm not sure that they understand yet what we're talking about tonight in our second opinion, that government-run health care is not going to give them the choices that they're used to today. They're not going to be able to stay in their private plans because they're going to be priced out of the market. They're going to have to go to that government-sponsored plan that is going to markedly narrow their choices. And what it's going to do is it's going to kill people, because we saw in the stimulus bill a new program set up in the federal government to look at cost effectiveness and comparative effectiveness, comparing the effectiveness of health care decisions. And age is going to be one of those measures of how those decisions are going to be made. And we already see this happening in Canada. We already see it happening in all the socialized health care systems around the world. When people have celebrated a few birthdays and getting what growing up down in Georgia folks talked about long in the tooth, a little white-haired, as I've turned into be, then what happens in those government-run health care systems is they just deny the procedures, deny the test, deny the care that the people need to stay alive, and people just die. Now in Canada, system that many tout, many on the other side in the Democratic Party tout the Canadian system and others. If you are a certain age and need a kidney transplant, you just don't get it. If you need bypass surgery, if you're a certain age, they'll put you on a list, but you never get off the list, you just die. If you need medications, you deny those. If you have cancer treatment that's needed, you just don't get those. We in this country, with the health care that we as physicians can give, we've made marked strides since I graduated from the Medical College of Georgia in how people survive various forms of cancers. In fact, I think Dr. Rose probably will talk about breast cancer because he very eloquently talks about that frequently. But our breast cancer survival rates in this country are extremely good. In other countries where they have socialized medicine, people die and very poor long-term survivability of that disease. Heart disease, diabetes, you can go down the list of all these chronic diseases. In socialized healthcare systems, as this administration and the leadership in this House and the Senate across the way want to take us, it's going to take away people's choices. They're not going to be able to get the care that they desperately need to stay alive. And it's just the wrong thing to do. And Dr. Gingrich, I just congratulate your efforts in trying to bring these things out to the American public. And I appreciate your being one of the co-chairmen of the Doctors Caucus and helping the American people to understand the direction that we're being led by this leadership, the liberal leadership in this House and the Senate, because it's not going to be in the best interest of the American public, and it's actually going to create a financial collapse, as Dr. Fleming was talking about. It's going to be exasperated and exacerbated, and people are going to be exacerbated because of this rationing of care, taking away their choices. And some federal government bureaucrat in Washington, D.C. is going to make those health decisions for them. It's not going to be their doctor, it's not going to be their family, and it's not going to be the patient. And it's the wrong thing to do. And I thank you for yielding.
Reclaiming my time, and I thank the gentleman before yielding to